Hello, ladies and gentlemen. Thank you very much for joining me today for this valuable webinar on natural treatments for degenerative bone conditions, according to Ayurveda. So, of course, in Western terms, we're referring to osteopenia and to some degree, osteoarthritis and osteoporosis. Arthritis is with the inflammation. So osteoporosis, more advanced. Osteopenia, you're halfway to osteoporosis. But we're just going to call them degenerative bone conditions at this point. This is in Ayurveda, this is a vata imbalance. So, our bones are dry, light, and have air. They're governed by vata. And this is a depletion. So we call vata kashaya. So there's a depleted state in the body. This is not a condition of excess, such as obesity, fatty liver. This is a condition of depletion. So the treatment is nutritional and building, we could say. So we're going to start off first with the common causes of this degenerative bone conditions. And then we'll talk about signs and symptoms, besides just, of course, measuring your bone density, which is, the clearest way to do it. But there's many signs and symptoms of degenerative bone conditions. And then we're going to talk about treatments, both food and herbal and lifestyle. So first, let's start with common causes. There are many causes that can contribute to degenerative bone conditions. There's many medications, for example, many diseases, arthritis, lupus, autoimmune conditions, even organ transplants and medication and cancer treatments that can result in degenerative bone condition as well as a side effect. And the most common, of course, is steroids. We just needed to cover that quickly. More common causes are, B12 deficiency, calcium deficiency, magnesium deficiency, trace mineral deficiency, but also malabsorption being the major one, and many conditions that are involving malabsorption, like celiac, ulcerative colitis, inflammatory colon conditions, all lead to malabsorption, where you're not absorbing your minerals. And of course, when you have inflammation in the colon, there's certain parts of the colon absorbing different parts of the minerals. And when it's inflamed, you're not absorbing the minerals. So even when I'm treating people with ulcerative colitis or irritable bowel, they're recovering from the inflammation in their colon. And when I'm done, they can actually still have nutritional deficiencies, because often the people don't seek proper treatment for years, and then the condition is already progressed. There's already deficiency. There's already weight loss, and then it takes me a few more months to treat it. And often the people find themselves anemic, low in minerals, low in vitamins, and having degenerative bone conditions after such an inflammatory colon condition. So that's common. Of course, kidney failure, those on dialysis also have degenerative bone conditions, and some conditions that, of the liver, certain liver diseases will also contribute to degenerative bones. More common ones are menopause, after a woman goes into menopause, or estrogen levels are lower. This is a very common cause of degenerative bone conditions. Now, as I said, it's a vata condition. So as you know, vata people are light, cold, dry, and we could say they're thin, cold, and have tendency more to be underweight or lose weight. So these are the people more susceptible. And then a woman after menopause is even more susceptible. So if you're a vata prakriti body type, or you have vata imbalance because you've been through a disease or an illness where you haven't eaten and you've lost a lot of weight, then you're more susceptible. And other causes, of course, are dieting, skipping meals, excess use of coffee, living off of smoothies, low-fat diet, because the bones, as per Ayurveda, you know, ashti, the bones are supported by other tissue that slowly is digested and producing the nutrients for the next tissue. So if your skin is dry and cracking, or we call rasadatsu, your liquid of the body, then you know all of your tissues will be depleted, including the bones. If your blood is depleted, like in the case of anemia or low magnesium, calcium, this is like depletion in the blood. And then if your muscles are depleted, and if you're on a low fat diet, you know, you've been avoiding fat, maybe because you had cholesterol, so you just stopped all fat, you know, the bones tissue, or ashidatsu, needs this fat, it needs these nutrients, it needs this liquid, you know, so any depletion of tissues will lead to degenerative bone condition ultimately. Now in Ayurveda, they have other causes, including not having sufficient milk, not being breastfed long enough. These can also be causes, and there's other causes like, you know, heavy metal toxicity can also lead to degenerative bone conditions. So many causes, very common, and most common, of course, with the vata imbalanced person who's dry, light, and often underweight and thin. The other type of person, of course, is pitta, maybe pitta vata, has a high metabolism, exercising and dieting extensively can lead to nutritional deficiencies and degenerative bone conditions ultimately. Of course, in the medical world, they give you synthetic D3 and synthetic calcium, which is, you know, if it was 1950s, this would be a good cure, but we do live in a modern world. We have natural supplements now, food-based supplements, and of course, there's many very effective herbal remedies. And unfortunately, by just, you know, taking calcium or magnesium or mineral supplement or D3, which I don't believe really mimics the value of the sun. I don't believe we can put the value of the sun into a synthetic substance like D3 and feel that we are really getting the benefits of the sun. So lack of sunlight, which will result in D3, is another one of the causes. But more important here is if the cause is malabsorption, or the cause is, which is a type of poor digestion, if the cause is overexercising, overexertion, if the cause is you know, skipping meals and living off of coffee and dieting and low-fat diet, then just taking calcium supplements and mineral supplements, you're not removing the cause. So the first treatment in Ayurveda is always to remove the cause. So that's why we covered it first, because you need to remove these causes and not just think that taking calcium supplements and magnesium supplements and mineral supplements, which are synthetic, are going to fully treat your condition. So digestion has to be good, absorption has to be good, which involves elimination, and even sleep can be a factor. So it's never good to look at a condition in an isolated way where you're only seeing, ignoring all of your other health problems and looking only at, okay, I have low bone density, what should I take? It's better to look at things holistically, look at the causes, look at the diet, look at the digestion, look at the sleep, and possibly even medication a person's taking to determine what the causes are. Because only when you remove these causes are you able to fully treat this condition. So signs and symptoms that your bones are depleted. Of course, if you go get a test, a bone density test, if your numbers are more than 1, then this is normal. If you're less than 1, down to 2.5, osteopenia. And if you're 2.5 or more, osteoporosis. would be the diagnosis. So we could say osteopenia is halfway to osteoporosis, a more serious degenerative condition. That's the easiest way to know, is this bone density test, but other very clear signs and symptoms as per Ayurveda, which are very evident: cracking nails or brittle teeth, hair loss, brittle hair, just splitting, breaking up, ridges in the nails. Your hair are all made of minerals and calcium. So, similar to your bone, your teeth basically are bones being held by your gums, which are muscles. And so if you're having cracking molars, cracking teeth, a lot of cavities, deep vertical lines in your ridges, in your nails, they're brittle. Soft nails also are a type of weak bone, but it's the brittle ones and the splitting and the not growing that is the real indicator of poor bone growth. So many things we can do with our diet to improve this condition. And that is to first understand that this condition is not a toxicity condition unless heavy metals were involved. This is a depleted condition. So any fasting, celery juice fasting, skipping meals, having coffee is only going to make the situation worse or make the pathology of the condition progress. And you're trying to stop the pathology first and then rebuild the tissue, in this case, the bones. So often we find a thin person, underweight, very active, skipping meals, sometimes over-exercising, stressing out. This is your typical person. And of course, after menopause, we find the same situation, but even more common for a woman after menopause who's very active, not eating 3 meals a day, and fasting. And then we see the nails, the ridges, the concerns about hair loss. And then, of course, they get tested, and the doctor tells them you have a degenerative bone condition. And now this person needs to realize that, skipping meals, trying to lose weight, fasting, following a low-fat diet is why they have the condition. So just taking calcium is not treatment. So if we talk about foods that are building and strengthening, dairy being number one, raw milk. Not many people have an aversion against milk, and unfortunately many vatas have a little difficulty digesting milk. We do tend to blame the milk when usually it's poor milk. Homogenized milk is harder to digest. Pasteurized has killed all the bacteria, which makes it, again, harder to digest. So homogenized pasteurized milk is hard to digest and harder to then absorb. But raw milk is very nutritious and very well known through the centuries to build bones, particularly goat milk. Goat milk is warmer than cow milk, which is cooler and more suitable for the vata type. And there's many vata types who only can digest goat milk. But there's other types of dairy, cottage cheese, soft cheeses, not fermented cheeses, ghee, butter, and all dairy products are a building in this sense. Remember, we're not talking about, cleansing, detoxing, or losing weight. We're talking about building and strengthening. So that means even too much beans would be counterindicated. More fish, dark chicken, more animal protein is all indicated for this condition. And, there are other alternatives for some of these nutrients. There are some mushrooms that are high in vitamin D. Cod liver oil has vitamin D, vitamin E, vitamin A. This is a nice supplement. So you can get natural vitamin D from cod liver. And also, there's bone broth. Bone broth is full of nutrients and vitamins, collagen that helps with hair and the nails and the bones. So this is there to get bone broth, again, animal product, cod liver oil, animal product. And other foods are like tahini. tahini, and anything made from sesame oil. If you're vata, your body's cold, you have nervousness, and you have degenerative bones, and sesame oil massage, cooking with sesame oil, having sesame seeds, chewing on sesame seeds is a Ayurvedic remedy for building bones. We have tahini, which is sesame paste. So sesame is very good. Other lifestyle recommendations is not overexerting, not running, light weights, walking up steps, light exercise will build muscle and strengthen bones. Obviously, sitting in a chair on a computer all day does not build bones. So you can see how in our modern society, where we're obsessed with weight loss, avoiding building foods like dairy, wheat, we love fasting, celery juice fasting, and sitting at a computer, you can see how we can end up with weak bones. So yes, all these substances that I just recommended, dairy, animal protein, even cod liver oil, they're all going to be building and strengthening. So you won't be losing weight while doing this. So next we could talk about herbs. There's many herbs that can help. The most common one is called pravalpishti. Pravalpishti is a type of coral, and it's a type of natural coral. Now, we don't call it just coral, it's called pravalpishti, and that's because it's been, the coral's been powdered and then cooked multiple times, so with herbs like triphala to make it more digestible. And so that's, and then ashwagandha. Many people know about ashwagandha. Ashwagandha, there's organic ashwagandha. This is a building substance. When people are overweight, sometimes they're doing ashwagandha. I tell them ashwagandha is a building food. It's not a weight loss food. So it's building. So people who are underweight, depleted, fatigue, weak, with degenerative bones, they do very good with ashwagandha. And in fact, home remedy is ashwagandha in milk. For here we go. We got some whole milk here, Texas whole milk. I don't have the raw milk, but that's better. Other herbs is balamul root. It's a root. So, but we just call it bala, and bala means strength. And this is also known to build bones. Vidarikan mala, which is also a root. Vidarikan is very similar to the sweet potato and good for building bones. So we can see here our bone building formula. Oh, and moringa, I didn't bring it out, but moringa has had its day of being a fad food where everybody was doing smoothies with moringa until they found out it doesn't taste very good. And it's very heating, can bring on acid reflux. There's many counterindications to it, but it is very super nutritious. But if you look at our bone building formula, Ayurvedic bone building formula, it says, high in calcium and minerals, for building bones. And you can see the first ingredient is ashti srigala, which I didn't bring out. Ashti means bones. So this is this one herb which I didn't bring. It was just white powder. And it's called ashti srigala. And they named this herb after they called it bone builder in a way. The leaves look like bones, and we only use it in this one formula for building bones. And there's the pravalpishti, which we talked about, the natural coral. And there's Arjuna, it's another herb. There's your moringa, bala, which I just mentioned, and dashamoola. Dasha means 10, mool means roots, 10 roots. So that's also a very nutritious substance. And ginger is just there to help you digest it, because these herbs are very heavy and they are hard to digest. Even when you feel it, it feels like a very heavy substance because there's a lot of minerals in there. And you need that ginger to digest it. And if you look at the ingredients, it's the instructions, it says best in 1 or 2 teaspoons in warm milk a couple hours after dinner, because we best absorb these minerals at night when we're resting. Now, there's another herb called lakshadi guggul, and lakshadi guggul is a resin, just like frankincense is a resin. So they're in little tabs. We call them bone building tabs. But if you look at the very last ingredient, it says lakshadi guggul. Yeah. So they're very effective as well. See the little black balls of resin, guggul, and it's used to manage low bone density, and even we use them for osteoarthritis as well, because they do help with bone pain, and they're also anti-inflammatory. So people take a couple of those a day. We have to change the diet, no more skipping meals, have a more nutritious building diet, and a lot of vata type people who are thin, and they're very concerned about gaining weight because they've been thin their whole life. And now when you talk about having more fish and chicken and no longer being vegetarian, having more dairy and no longer being vegan, skipping meals and not just having coffee, they're panicky, worried about gaining weight. And probably they will gain weight because they are underweight. And it takes a little convincing to convince a thin woman that she needs to gain a couple more pounds. But once she gets the bone density test and she sees that she has degenerative bones, and knowing that later in life she could break bones, have hip fractures, if she doesn't resolve this, then it's almost proof that you're depleted and you're underweight. Because when you build your bones, and build some more muscle, your weight's gonna go up. The person will still, and a lot of times people are on a low fat diet trying to lose weight. So they got to consume more fat, build more bones, build more fat, build more muscle, all need to increase. So the person's weight will go up, but only naturally. It won't keep going. This is an important thing to understand. Unless if you're kapha prakriti and you're very overweight, you probably don't even have degenerative bone condition in the first place. So it's almost exclusively with a vata type of person, unless there's other causes, some of which we mentioned earlier, like certain diseases and medication. Almost all of the degenerative bone condition cases I see are thin, elderly women already in menopause state of life. So we have a few other things that can build bones. We have shilajit. We call it mineral energy powder, but basically it's just pure shilajit powder. And it's a trace mineral supplement. It's got folic acid and traces of most minerals, including it helps you build bones. It's a vitamin, a supplement, a natural supplement, trace mineral supplement, because what we're doing here is we're building, and we have to have digestion good. We have to have the person hungry. They have to be eating. So we also work on the digestion. And here's another building supplement. It's just for vata, it's for cold, thin, dry, underweight people. And you can see that the second ingredient is dashamoola. First one is wheatgrass, and then spirulina, chlorella, and there's ashwagandha again, beetroot powder, very nutritious, and then the cumin, cinnamon, and there's a little kelp there because seaweeds also are very good at building bones and very nutritious. So this is a very beneficial formula as well, because it's covering a lot of nutrients, and it's got more ashwagandha in it, and it can be taken every morning with some more milk. And then before bed, you can take the bone building formula before bed. The energy tabs or powder you can have in the morning, or mix it with your superfood. These go together very nice. This is basically a vitamin pack right there, and a little cod liver oil for your fat soluble ones. Then you take a little bone tabs, 2 of those twice a day with meals. And if further, is you could drink this tea all day, and the tea is a vitamin mineral supplement. And the horsetail is high in minerals and calcium and known to build bones. This is just a general Alfalfa is also good. Nettles also good. And some of these other ones are more for other vitamins, but this is going in the right direction, not specific for your bones, but going in the right direction. Building, strengthening, having natural sources of minerals, vitamins, reducing down stress, reducing down work, reducing down excessive exercise, resting more, sleeping more, and doing only like walking upstairs and light weights to help build the muscle and help to strengthen the bones. So of course, bone tissue does take some time. I mean, if you're dehydrated and your skin's dry and itchy, you can recover in a few days if you know what you're doing. There's many tricks. And same for nutritional deficiencies in your blood. If you eat the right foods and some of these products I mentioned here, you can improve the nutrition of your blood quite quickly. But bones are going to take time because they're a deeper tissue, a slower building tissue. So you really need to give it minimum 3 months and up to 6 months on this type of program. And so this is, this is a type of program that will help you to overcome this condition quite quickly if we talk about it only being a few months. A few months is a very short period of time to recover. And this is much better than having fractured hips and a hair falling out in later in life. So once again, it's treatable with both change of lifestyle and dietary changes, improving digestion, and herbal nutritional supplements, as I showed you today. And if you'd like to address your degenerative bone condition and all of the other factors that may be contributing to it, like improving your digestion, your elimination, feel free to contact me, and I'll be happy to assist you and provide you with some of these products and give you dietary guidelines specific just for you. Thank you very much, ladies and gentlemen.